Next, we're going to be talking about pharmacodynamics. This is an aspect of pharmacology that you as nurses need to understand to provide the best care for your patients. Again, as a definition, pharmaco refers to medicines or drugs, which we talked about earlier, and dynamics is change. You've used the word a lot in your everyday language about dynamic, and it's changing. So in here, pharmacodynamics refers to the mechanism of action of drugs. You probably have heard that before, and when you look up drugs in the drug manuals, they talk about the mechanism of action. So again, we're talking about the change that occurs in the body as a result of the person taking a medication. This has a lot to do with the pathophysiology connection to pharmacology. Patients vary and they respond differently to drugs. You can have 3 patients who can be given the same dose of a drug and they could be responding differently. So again, later this week we're going to be talking about pharmacogenetics, and Ms. Gail Marcus is going to be talking to us about pharmacogenetics. It's going to provide a little more understanding as to how come one patient varies from the other. Okay, this is a frequency distribution curve. ED50 is, again, half of the population, or the average, has an effective dose. So here's your medication we're looking at in milligrams. So a 50 milligram dose of this medication is considered the average or the effective dose. So again, if you're going to be looking at here, there's going to be 50 patients who have to have at least 85 milligrams of that dose to reach the effective therapeutic effect. Over here, there's 50 patients who only really need about 15 milligrams of that medication to have the effective therapeutic dose. So patients vary. So again, you don't know if you should be giving, again, when you start off the medication at the 50 milligram dose, you're going to have some patients over here at this end of the curve not responding to it. These are the patients who need to have that dose increased in order to have a therapeutic effect. But on the other hand, over here you have these 50-some patients who only need 15 milligrams of that medication. If they're receiving 50, they don't need it, and there's that much more chance for serious adverse effects. This is just what we talked about. Next, we're going to be looking at the therapeutic index. This tells us how safe a drug is to be administering it to a patient. Okay. Again, we're looking at the safety aspect of medications. The effective dose we'll look at first. It's ED50. This is the desired response, the effective response in 50% of the subjects during the clinical trials. The median lethal dose, again, this is what you would think it is, 50% of the test subjects died when they were given this dose of that medication. Again, these subjects are not patients. Keep in mind these are clinical drug trials that were done in laboratory testing. Just make sure you understand that these were done in laboratory animals and testing situations and not to humans. So here's your therapeutic index in a graphic table. ED is your therapeutic effective dose. So here in this drug it's a 10 milligram dose of drug X, they're calling it. The lethal dose for the 50% of the people who died at this dose of 40 milligrams was given to them. Does everybody see that? So again, in order to figure out the therapeutic index of drug X equals the effective dose over the lethal dose over the effective dose, or 40 over 10, and it's 4. So the therapeutic index of drug X is considered 4. Here is one that has a narrow safety margin. It's a low therapeutic index. Again, you have your therapeutic effective dose of 50 is at 10 milligrams. Then again, they did a lethal dose that was figured out to be about 20 milligrams. So again, the therapeutic index is only 2 for this drug. So again, it requires much more closer monitoring of therapeutic blood levels, and the danger of adverse effects is much more serious than if you had a therapeutic index of 4. We're going to talk about agonists and antagonists. You probably come across these words in your previous educational program, and as well as when you're administering drugs, if it's an agonist or an antagonist. So an agonist is one that does the same activity as the endogenous substances in your body, or as other medications. They could be working along together. And a partial agonist is, again, a little bit weaker than the full strength of the agonist. Antagonist is the opposite effect of the other drugs or other normally occurring substances in the body. Again, they're going to be blocking them, and they stop the effects of other medications. Those of you who are working in clinical practice know that morphine can be given at quite high doses for some patients, and again, the Narcan is the medication that would reverse that effect. So Narcan is an antagonist of the drug morphine. Just another graphic picture that shows you how it works, which is a little bit better. And these are receptors. Again, for medications to work, they have to attach to a receptor. So an agonist clearly attaches to this receptor fully, so you're going to have 100% of the dose. You have a partial agonist, which again could be blocking another medication, so you're only getting a 50%. You have a full antagonist, it's taking the receptor site completely, and you're having a very minimal effect of the other medications. Agonist plus antagonist, it's a 50-50 response, so you have about a mid dose. So again, that is the end for today.